Today, I'm gonna talk about entrepreneurism ethics project, and in this project, I created a company called CareSphere, which is basically what it does is implements AI in the healthcare industry. So first, I'm gonna show you guys a report that I made for this company that talks about the company's summary. And CareSphere is basically a company designed to help with the diagnosis of patients by speeding up the intermediate processes and assisting doctors with workaday tasks. So basically, what it does is it uses kiosks implemented in each hospital, and it has ML algorithms and other software loaded onto it. So when the patients, when they come in, they can look at these. They can look at these questions that are designed to stimulate them to answer with their patient data and images, like any images they have of like blood cells and stuff like that. So our convolutional neural networks could analyze whether they're like malignant or benign, based on what disease they specify. Like if a patient had cancer, these kiosks would help determine what stage of cancer the patient is on and the severity of the cancer cells in their body. And so I also talked about CareSphere stakeholders, and I initially had an objective in OKR, which was to achieve a success rate of 90% all anemia related cases. But then in the future, when I was actually starting the entrepreneurism and ethics project, I changed this OKR because I felt that it was too it wasn't inclusive of all other diseases. So I created more OKRs, and I even created a risk table. And so what this risk table does is that it includes each stakeholder, and then it talks about the financial, privacy, conflicting interest, and violation of rights risks that are for these stakeholders. Like for example, CareSphere has a high financial risk because we're getting a lot of money from investors and venture capitalists and technology partners, and if we mess it up, then we could actually lose a lot of money, and the company could shut down. So there's a high financial risk. So we explained things like these, and then we also talked about ethical safeguards that are put in to prevent like private breach of privacy, algorithmic bias, and we even created a robust data privacy and consent management system. And then in the end, I included my references. So I have like four references, and this was done on using these references, and I gained data from them. So now I'm going to go into my actual project, and I'm going to talk about item one, which is the ethical business plan. So in this plan, I first included what CareSphere actually did, what it was, and the long-term vision statement of CareSphere and how the idea originated. So the idea originated when I was just like in a class discussion in my computing responsibility class, and we were all talking about potential startups that we could do as students based on the available knowledge, existing knowledge we already have. And so I was like saying like how I did a malaria AI project in high school, which involved using a convolutional neural network to analyze red blood cells and see the amount of disease in it, and like classify whether it was it was a disease cell or it wasn't. And so since I already had this existing information and I've worked with CNNs and other AI algorithms before, I thought I could create a company like CareSphere, which uses the same type of software to help assist in the healthcare industry and revolutionize it. So this was really interesting because this ethical business plan showed us that we could actually create a startup in the future. While this is a hypothetical startup, CareSphere, it helped teach me that with an idea and like a good solid plan, we could actually implement something like this. And so next, I talked about my purpose, values, and missions for this company. So our general increase in the use of AI in the healthcare industry was our purpose, and not only in diagnosis but also assisting doctors with everyday tasks. So in the future, in the remote future, when technology involving automated robots become popular, we were thinking that we could establish these robots in healthcare industries and help doctors reduce the number of menial tasks they perform, like performing injections, asking questions to patients and stuff like that, using these robots. And then I had some key questions like whether the kiosk machines would run algorithms of AI, like would these kiosk machines that actually run the AI algorithm, would they actually make any difference, and whether these algorithms would be biased or accurate enough for patients to gain trust in it, and would health professionals would health professionals ever let these physical aspects of the medical process like be trusted more than their be trusted at the hands of AI robots or kiosks more than themselves. So those were important things to think about before we actually started planning OKRs and objective and key results, setting up experiments and ethical safeguards and things like that. So the first OKR we had was to develop our AI diagnostic tool to achieve a 90% accuracy rate in 3 years. And so some key milestones towards the objective was like advancing CNNs and identifying, staging, and monitoring, completing complicated tasks like cancer, diabetes, and other cardiovascular conditions. So this was actually a really practical OKR because we had a lot of time. We have 3 years to do this, and we decided that okay, it's just 90% accuracy. It's not 100 because we decided 100 was like a far stretch, and if we have like a practical accuracy rate, then we could actually gain patient trust and establish more of these kiosks all around the world actually. So and we also decided to design an experiment for OKR1 where the model will be tested retrospectively and prospectively using the data sets that were collected to validate the accuracy of the tool in diagnosing diseases like cancer and diabetes. So the procedure was to first create a data set using historical medical data and patients, and then real, current clinical data, and then we use these data sets and run it with the model to see if it produces accurate results, and if it doesn't, then we modify the data set to make it easier on the model, or modify the model to make it more accurate and precise. We then also perform some AI. We compare AI reports to expert verified diagnosis for accuracy, making sure that our reports are pretty accurate and it matches the bar that we've set for the position. So this would help us gain at least a 90% accuracy, and so we decided we have some metrics to see if we could ensure that this happens. So key metrics will include like ensuring the diagnostics at the highest level include diagnostic accuracy at 90%, 95% reliability, 85% or at least like more. And we set a metric like for this, like using these percentages so that we can analyze and have a high goal. And some ethical impacts that arise from this or bias in the data or consistency of accuracy might not be enough, and even though we're running the model on trained data sets, it might lack some it might miss some data in minority groups or in popular diseases. So we thought, okay, we need to fill in these gaps by asking medical professionals to fill in the holes in the data and make sure that we can reduce the bias by first fixing the data, which is the first step. Some ethical safeguards, I just mentioned ethical safeguard that we could do, talk to medical professionals, and some others were working in collaboration with a panel of medical professionals to conduct regular audits that will validate these AI diagnoses. And we can also minimize the number of samples across key demographics such as age and ethnicity, and we can conduct rigorous training protocols that involve a wide range of variables to cover for anything that's outside a regular situation. And we can call significant leaders from the STEM field to remove bias and provide solid diagnostic capabilities. Next, we have a risk table for OKR1, which involves every stakeholder and their financial, privacy risk, conflicting interest risk, and violation of rights. And I'm just going to talk about one, for example, due to the consent of time. And so for patients, patients have a very low financial risk because they're only paying for the diagnosis, and they're not they don't pay too much to get a checkup or something like that. So I said that they have a low financial risk, whereas CareSpear has a high financial risk because they're getting a lot of money from investors and other stakeholders like technology partners. So if they mess up the AI diagnosis, or they have a breach of they have a privacy breach, or any data is leaked, then bad things could happen. The company might have to shut down or go bankrupt. So they have a really high financial risk. So and then we also we talked about the rest stakeholders, and our second OKR is to reach a 70% AI adoption in the healthcare industry by deploying accessible diagnostic kiosks across hospitals and clinics. So what this basically means is that we want AI to be adopted to like from like 0% to at least 70% overall, because that would mean that it's a key milestone for us. If we complete 100 kiosk deployments in various healthcare settings, which all have the software which is the ML and AI algorithms loaded up. So we can do this by establishing partnerships with at least like 50 healthcare providers and hospitals and etc. And we can use the kiosk to enable preliminary screenings at high speed, which relate to common issues like hypertension, diabetes, early cancer indications, and things like that. And so our experiment could be involving deploying 10 pilot kiosks in various healthcare settings such as hospitals and clinics to test for functionality and adoption rate among the staff. We could then to make sure this is seamless. We could each kiosk can be fitted with standardized AI supported diagnostics, including blood pressure and glucose level testing, and we could perform. We could give out training modules for all health staff, and first time patients, so that they know how to use the kiosk. And if the patients and doctors find it easy to use and also useful, then that would mean our experiment was successful, and the OKR is actually successful. And our metric is to adopt this by making sure the deployment reach will be tracked by monitoring the percentage of partner healthcare facilities that deploy our kiosks, and the goal will be at least 80% of those trained using the AI tools will be adopting them permanently. And then patient satisfaction scores will also be collected via surveys. So this will help make sure that we have at least 70% adoption, or we can measure how much we have. So some ethical impacts that arise are over dependence on these machines, but we can prevent that by creating a verification system at the end of the kiosk diagnosis. So this makes sure that doctors still are involved in the menial task, but only as like a quick verification check for the kiosk. And then I also include the risk table again, and due to low time, I don't want to go over that again. The third OKR will be within 5 years we should be compliant with GDPR and HIPAA, because this is critical, because we need to be compliant in compliance with them, so that we can tend to all patients from all races and ethnicities and stuff, and also we can be secure and verified. And some metrics include 100% pass rate for the data handling practices met at the standards of GDPR and HIPAA. And some ethical impacts that are like missing the standard by like a little percentage because of some breach or something in security violations. So what we do, some safeguards we can have, is penetration testing regularly using from cybersecurity experts, and also we can have like a robust data secure management system. This would help reduce the breach of data or potential risk from hackers. And then we also have a risk table again and an explanation. And now I'm going to move on to my next item, which is cultural policies. So here the core values of the company are demonstrated, like honesty, compassion, creativity, diversity, and pledge to precision, safety, and relentless improvement. And next, I'm going to talk about the motivation for the company, which comes from, pre-existing AI healthcare companies, and like how we want to nurture lives with surgical innovation. And we have this vision that over the future, healthcare would be revolutionized by the AI algorithms. And our 6-word summary for the company is empathy-driven innovation for healthcare transformation. And then the second to last item is the ethics policy. So I'm just going to read them off, like the, overall what it is. It's like patient consent and autonomy, data security and privacy, fairness and non-discrimination, transparency and explainability, accountability and continuous improvement. So these are all our core items for the company, because we want to make sure that we're held accountable for our things, for our diagnostics, transparency, fairness. We have a board, and the top 3 important people in our board is Dr. Fei Li, Dr. Timnit Gebru, and Dr. Eric Topal, who are all established, highly educated officials in the field of STEM and AI and ethics. And so here are references. So I use 4 references. Like first one to cultivate an ethical business practice, and then second, I read about how AI is already being used in the healthcare industry to revolutionize it, and any investigation of biases in CNNs, which help us reduce the amount of bias. And then for the HIPAA requirements and forms for research, I looked at that to understand what would be required by HIPAA. So that's it, guys. Thank you for watching. So I hope you got a lot out of my presentation for this project, and I really hope that you guys, start your own startups and be inspired by projects like these and how I was inspired when I started. And I'm really glad that you guys all listen, and thank you for watching. Have a nice day. Catch you in the next one. See ya.